Hey, future counselor, if you have been reviewing your terms, reviewing the concepts, and just studying consistently, and you are ready to test your knowledge with some practice questions, you're in the right place. Today, we're going to go through 50 alcohol and drug practice questions together. We're going to go over the correct answer and why it's the correct answer, and also why the other answers are wrong. If you are new here, welcome. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment professional. I support future counselors with studying, building their confidence, developing a strategy to pass their licensing and certification exams. Let's go ahead and get started. Question 1. A client reports drinking a pint of liquor daily and stopping suddenly. Which symptom suggests alcohol withdrawal that needs urgent medical evaluation? Mild headache that improves with water, hand tremors and sweating, increased appetite, or feeling bored and restless? The correct answer is B. B is correct because tremors and sweating are classic withdrawal signs and can worsen. A is incorrect because a mild headache alone is not a strong withdrawal red flag. C is incorrect because increased appetite is not a typical withdrawal risk. And D is incorrect because boredom can occur, but it's not a medical risk sign. So again, the best answer is B, hand tremors and sweating. When someone drinks heavily and stops suddenly, the nervous system can rebound and cause withdrawal. Tremors and sweating are common early withdrawal signs and can progress to seizures. A mild headache can happen for many reasons, but it doesn't tell us the body is in withdrawal by itself. And lastly, increased appetite is not a key withdrawal sign. Feeling bored and restless might be an emotional discomfort, but it isn't the medical warning sign that we should worry about. Which statement best describes tolerance? Needing less of a substance to get the same effect, needing more of a substance to get the same effect, using a substance only on weekends, or experiencing cravings only when stressed? The correct answer is B. B is correct because tolerance means more is needed for the same effect. A is incorrect because that is the opposite of tolerance. C is incorrect because frequency pattern alone does not define tolerance. And D is incorrect because cravings can occur with or without tolerance. So again, the correct answer is B. Tolerance means the body adapts, so the person needs more of the substance to feel the same effect they used to get with less. Needing less is the opposite idea. Weekend only use does not automatically mean tolerance, and cravings when stress can happen, but cravings are not the definition of tolerance. A client presents with pinpoint pupils, slow breathing, and decreased level of consciousness. What is the most likely substance category involved? Stimulants, hallucinogens, opiates, or inhalants? The correct answer is C. C is correct because opioids commonly cause pinpoint pupils and respiratory depression. A is incorrect because stimulants usually cause dilated pupils and increased heart rate. B is incorrect because hallucinogens more often cause perceptual changes and may cause dilated pupils. And D is incorrect because inhalants can cause dizziness and impairment, but pinpoint pupils with respiratory depression is more typical of opioids. Here you want to pay close attention to life-threatening signs. Slow breathing, pinpoint pupils, plus respiratory depression, plus decreased consciousness point strongly to opioids. Which lab finding is most commonly associated with chronic heavy alcohol use rather than one single binge episode? Elevated blood alcohol concentration, elevated gamma glutamyl transferase, elevated urine ketones, or elevated serum sodium? The correct answer is B. B is correct because gamma glutamyl transferase can be elevated with chronic heavy alcohol use and liver stress. This answer separates acute intoxication from chronic effects. Blood alcohol concentration tells you what happened recently. So that is what they're testing when they test people for DUI. Gamma glutamyl transferase is a liver enzyme that can rise with ongoing heavy alcohol use over time. A client on methadone takes a benzodiazepine to calm down. What is the greatest immediate risk? Elevated appetite, hypertension, respiratory depression, or increased pupil size? The correct answer is C. C is correct because methadone plus benzodiazepines increases sedation and can dangerously slow breathing. A is incorrect because appetite changes are not the primary acute danger here. B is incorrect because the biggest danger is not blood pressure either. And D is incorrect because pupil changes are not the main safety concern. Again, this is a safety question about mixing depressants. Methadone is an opioid and benzodiazepines are central nervous system depressants. When you combine the two, the sedation stacks and breathing can slow to a dangerous level. That is why overdose risk increases with this combination. The biggest immediate risk is respiratory depression. Which of the following is most consistent with stimulant intoxication? Slowed speech and drooling, increased energy and decreased need for sleep, severe diarrhea and goose flesh, or pinpoint pupils? The correct answer is B. B is correct because stimulants commonly increase energy, alertness, and reduce sleep. A is incorrect because slowed speech suggests a depressant intoxication. C is incorrect because that cluster is more consistent with opioid withdrawal. And D is incorrect because that cluster is more consistent with opiate intoxication. Again, stimulus push the nervous system into overdrive. So increased energy, fast thoughts, reduced need for sleep, and sometimes confidence or irritability fit stimulant intoxication. A client reports stopping heavy daily alcohol use, then develops confusion, fever, severe agitation, and hallucinations 2 days later. What is the most urgent concern? Delirium tremens, cannabis-induced psychosis, panic disorder, or mild withdrawal only? The correct answer is A. A is correct because delirium tremens is a severe alcohol withdrawal syndrome with confusion, agitation, instability, and hallucinations, often 48 to 72 hours after stopping. B is incorrect because the timing after stopping alcohol and the severe signs fit delirium tremens more. C is incorrect because fever and hallucinations and severe agitation suggest medical emergency, not panic disorder. And D is incorrect because the symptoms described are not mild. Again, timing is everything. Severe alcohol withdrawal can escalate around 2 to 3 days after the last drink. Confusion, agitation, hallucinations, and fever are red flags for delirium tremens, which can be fatal without medical care. Which medication is commonly used to reduce cravings and support abstinence in alcohol use disorder by affecting glutamate and GABA balance? All right, guys, bear with me here. These are some names: disulfiram, acamprosate, clonidine, and biupronine. Oh, biupropy. Let's try this again. Biupropion. All right. The correct answer is B. B is correct because this medication supports abstinence and reduces cravings by modulating glutamate and GABA systems. A is incorrect because this medication works by causing an unpleasant reaction when alcohol is consumed. C is incorrect because clonidine is used more for withdrawal symptom relief in opioid withdrawal, not as a primary alcohol craving medication. And D is incorrect because this medication is not a primary medication for alcohol use disorder. Okay, so this is a prime example of, I had a tough time pronouncing these medications, but I know exactly what each of these medications do. And you can do the same. Don't pressure yourself to be able to pronounce every single medication, but be familiar with different types of medications and what they're used for. Okay, the correct answer is B. B is correct because this medication supports abstinence and reduces cravings. A person who struggles with opioid use wants a medication that helps stop cravings, eases withdrawal symptoms, and has a safety limit so it doesn't fully activate opioid effects or increase overdose risk. Which medication best matches this description? a medication that fully activates opioid receptors, a medication that completely blocks opioid effects, a medication that partially activates opioid receptors with a built-in limit, or a medication that reverses opioid overdose. The correct answer is C. C is correct because this option describes a medication named buprenorphine. This medication reduces cravings and withdrawal, partially turns on opioid receptors, and has a sealing effect. A is incorrect because medications like this fully activate opioid receptors. This would describe a medication like methadone. It helps with cravings and withdrawal, but it does not have a sealing effect and carries a higher overdose risk. B is incorrect because this choice would completely block opioid effects. This would describe a medication called naltrexone. It does not reduce withdrawal and requires the person to be fully detoxed first. And lastly, D would be incorrect because this type of medication would reverse opioid overdose. This describes a medication like naloxone. It's used for emergencies only and is not a treatment for cravings or withdrawal. A client in early recovery says, I feel emotionally numb, irritated, and just low. Nothing feels enjoyable. The client also reports poor sleep and low motivation since stopping stimulant use 1 week ago. Which interpretation is most accurate? The client is experiencing dysphoria related to stimulant withdrawal. The client is showing clear signs of opioid intoxication. The client is experiencing delirium tremens from alcohol withdrawal, or the client is showing typical cannabis intoxication effects. The correct answer is A. A is correct because dysphoria is an unpleasant mood state that can include irritability, low mood, emptiness, and reduced ability to feel pleasure. After stopping stimulants, people often experience a crash with depressed mood, low motivation, sleep changes, and dysphoria is linked to withdrawal. B is incorrect because opioid intoxication typically presents with slow breathing, sedation, and pinpoint pupils. Excuse me. Emotional numbness and low pleasure can happen with many conditions, but the timeline after stopping stimulants and the symptoms described fit withdrawal more than opioid intoxication. C is incorrect because delirium tremens occurs in severe alcohol withdrawal and usually includes confusion, severe agitation, hallucinations, and instability like fever or very high blood pressure, typically 48 to 72 hours after heavy alcohol use. So that is not what's happening here in this question. D is incorrect because cannabis intoxication is more likely to include red eyes, impaired coordination, time perception might be off, increased appetite, and some anxiety. A client drinks a fifth of liquor daily and reports blackouts. Which term best describes blackouts? A loss of consciousness from overdose, a period of memory loss during intoxication, a seizure disorder unrelated to alcohol, or a panic attack caused by alcohol. The correct answer is B. B is correct because blackouts are gaps in memory formation during intoxication. A is incorrect because many blackouts occur without passing out. C is incorrect because this is not the definition of blackout. And D is incorrect because panic symptoms are different than memory gaps. Blackouts are not the same as passing out. A blackout is when the person is awake and doing things, but later they cannot remember what happened because alcohol has disrupted their memory. Seizures can occur in withdrawal, but that is different. And panic attacks, again, they are for fear-based episodes, not necessarily connected to memory loss. Which sign is most concerning for alcohol withdrawal that requires immediate medical evaluation? Mild headache and irritability, slight hand tremor, seizure activity, or increased appetite? The correct answer is C. C is correct because seizures can occur in alcohol withdrawal and can be life-threatening. A is incorrect because mild symptoms may be monitored, but they are not the most serious. B is incorrect because tremors are common but not the highest emergency sign by themselves. And D is incorrect because appetite is not the key concern. Alcohol withdrawal can range from mild to deadly. The symptom that should raise immediate alarm is seizure activity. A client reports using cocaine and then experiences chest pain and shortness of breath. What is the best immediate action? Encourage hydration and rest at home. Provide motivational interviewing and schedule follow-up. Refer for emergency medical evaluation, or suggest caffeine reduction. The correct answer is C. C is correct because cocaine increases risk of heart attack and chest pains need emergency evaluation. A is incorrect because chest pain after cocaine can signal a heart attack. B is incorrect because counseling can come later. Remember, safety first. And D is incorrect because caffeine is not the primary issue. Chest pain after cocaine is a major red flag. Cocaine can cause heart attacks, dangerous rhythms, and severe blood pressure changes, even in young people. The correct move is emergency medical evaluation. Which screening tool is specifically designed to identify alcohol use problems? Audit, DAS-10, PHQ-9, or GAD-7? The correct answer is A. A is correct because audit screens for risky and harmful alcohol use. The DAS-10 is for drug use, not alcohol. PHQ-9 screens depression and GAD-7 screens anxiety. So if you want a tool aimed at alcohol risk, you would choose audit. Audit is the correct answer. Which presentation is most consistent with opioid withdrawal rather than opioid intoxication? Slow breathing and pinpoint pupils, constipation and sedation, dilated pupils and muscle aches, or slurred speech and ataxia? The correct answer is C. C is correct because opioid withdrawal often causes dilated pupils, body aches, runny nose, and an upset stomach. A is incorrect because this more fits opioid intoxication, the slow breathing and pinpoint pupils. B is incorrect because this fits opioid intoxication also, constipation and sedation. And D is incorrect because it's more consistent with alcohol or sedative intoxication. Opioid intoxication slows the body down like slow breathing, sedation, and constipation. Opioid withdrawal does the opposite. It revs the body up with dilated pupils, muscle aches, restlessness, sweating, and upset stomach. So the dilated pupils and muscle aches fix withdrawal best. A client who uses opioids daily wants to start extended release naltrexone. What must happen first? They must be fully detoxed from opioids. They must increase opioid use to build tolerance. They must take naloxone daily for 2 weeks. Or they must drink alcohol to test liver function. The correct answer is A. A is correct because naltrexone will immediately bring on withdrawal symptoms if opioids are still in the system. B is incorrect because increased use increases risk, and that's not required. C is incorrect because naloxone is not a daily treatment strategy for this particular issue. And D is incorrect because drinking alcohol is not a test strategy and is unsafe. Naltrexone blocks opioid receptors. If a person still has opioids in their body and they take naltrexone, it can trigger sudden severe withdrawal. And we want to make sure the client is safe. We want them to be as comfortable as possible. So the correct answer is A. They must be fully detoxed from opioids. A client says, I can only drink at night, but once I start, I cannot stop. I tell myself I will have 2 and I end up finishing the whole bottle. Which alcohol-related concept does this most strongly reflect? Loss of control, withdrawal, hazardous use, or cross tolerance? The correct answer is A. A is correct because loss of control means the person has difficulty stopping once they start, or they consistently use more than they intended. The client planned 2 drinks, but repeatedly ends up finishing the bottle. B is incorrect because withdrawal is about symptoms that happen when alcohol is reduced or stopped, such as tremors, sweating, nausea, or anxiety. This question is describing the inability to stop drinking after starting. C C is incorrect because hazardous use means using in situations that increase danger, such as DUI or drinking at work. This scenario focuses on quantity and control, not a danger context. And D is incorrect because cross tolerance is when tolerance to one substance reduces sensitivity to another substance in a similar category. That does not match this scenario. So again, listen to what the client is actually telling you. They say they only drink at night, but once they start, they cannot stop. That would be A, loss of control. Which condition is classically associated with confusion, eye movement problems, and unsteady gait and severe alcohol misuse? Hepatitis A, Wernicke encephalopathy, borderline personality disorder, or schizophrenia? The correct answer is B. B is correct because Wernicke encephalopathy is related to heavy alcohol use and can cause confusion, eye findings, and ataxia, which is unsteady gait or not being able to catch your balance. A is incorrect because hepatitis does not match those symptoms. You don't get those symptoms from hepatitis A. C is incorrect because personality disorders do not cause these symptoms either. And D is incorrect because schizophrenia does not cause eye movement problems and unsteady gait. A client uses alcohol to sleep but wakes up at 3 a.m. and cannot fall back to sleep. Which is the best explanation? Alcohol improves sleep architecture. Alcohol increases deep sleep all night. Alcohol can cause rebound wakefulness as it metabolizes. Or alcohol has no effect on sleep. The correct answer is C. C is correct because as alcohol wears off, the body can rebound into a lighter sleep and wake you up. A is incorrect because alcohol disrupts sleep quality. B is incorrect because alcohol may sedate you initially, but later on it can wake you up and keep you up. And D is incorrect because alcohol does affect sleep patterns. Which is a common physical sign of cannabis intoxication? Nystagmus and ataxia, which are rapid eye movements and loss of balance, severe tremor and seizures, red eyes and increased appetite, or pinpoint pupils and slowed breathing. The correct answer is C. C is correct because bloodshot eyes and increased appetite are common with cannabis. A is incorrect because nystagmus and ataxia are more typical of alcohol or sedative intoxication. And again, nystagmus is rapid eye movement and ataxia is loss of balance or loss of gait. B is incorrect because seizures are not typical of cannabis intoxication. And D is incorrect because that pattern is more consistent with opioid intoxication. A client reports drinking alcohol most evenings and says, I do not drink to get drunk. I drink because it helps me feel normal and take the edge off. The client also reports feeling restless and irritable on nights they do not drink. Which concept best explains this pattern? Psychological coping only, physiological dependence, social drinking behavior, or acute intoxication? The correct answer is B. B is correct because drinking to feel normal and to relieve discomfort indicates physiological dependence. A is incorrect because the presence of restlessness and irritability when alcohol is not used suggests physical adaptation, not coping alone. C is incorrect because social drinking is not driven by symptom relief or a daily need for it. And D is incorrect because intoxication refers to the effects while alcohol is active, not discomfort when it's absent. In this question, pay attention to the phrase, I drink to feel normal. That is a huge red flag and a clue on exams. When someone is drinking to relieve irritability, restlessness, or other uncomfortable symptoms, especially physical symptoms, it means their body has adapted to alcohol and now expects it. The pattern is physiological, it's physical, it's a physical dependence. That is more than just coping or social drinking. A client reports daily alcohol use and states, I am not drunk every day, but I feel shaky and anxious if I do not drink by late afternoon. Which interpretation best fits this pattern? Psychological dependence only, physiological dependence, episodic binge drinking, or acute intoxication? The correct answer is B. B is correct because anxiety and shaking relieved by drinking indicate physiological dependence. A is incorrect because physical symptoms suggest more than psychological dependence alone. C is incorrect because binge drinking is about large quantities in one sitting, not daily relief drinking. And D is incorrect because intoxication refers to the effects while alcohol is active, not absence effects. The question is testing whether you recognize dependence patterns. The key detail here is feeling shaky and anxious when alcohol is not in the body, then drinking to relieve that discomfort. Again, like the previous question, that tells you the body has adapted and now wants alcohol. That is, again, physiological dependence. Which situation most clearly demonstrates negative reinforcement in substance use? Using alcohol to feel euphoric at a party, using opioids to stop withdrawal symptoms, using stimulants to enhance focus at work, or using cannabis to increase enjoyment of music. The correct answer is B. B is correct because stopping discomfort is negative reinforcement. A is incorrect because that is positive reinforcement and it's gaining pleasure. C is incorrect because enhancement is also a positive reinforcement. And D is incorrect because enjoyment increase is also positive reinforcement. Negative reinforcement means using a substance to take away something unpleasant. When someone uses opioids to stop withdrawal symptoms, they are not chasing a high, they are escaping discomfort. A client reports that alcohol no longer causes relaxation, but instead increases irritability and anxiety. What concept best explains this shift? Reverse tolerance, rebound effect, cross dependence, or acute intoxication? The correct answer is B. B is correct because alcohol can cause rebound anxiety as the effects wear off. A is incorrect because reverse tolerance refers to needing less to get the same effect. C is incorrect because cross dependence involves multiple substances. And D is incorrect because intoxication refers to immediate effects, not post-effect worsening. Alcohol may feel calming at first, but as it leaves your body, anxiety and irritability can rebound and even feel worse than before. That shift from relief to worsening symptoms is called a rebound effect. Which factor most increases overdose risk after a period of abstinence? Increased insight, reduced tolerance, improved metabolism, or enhanced coping skills? The correct answer is B. B is correct because tolerance drops quickly during abstinence. A is incorrect because insight does not increase overdose risk. C is incorrect because metabolism improvement is not the key risk. And D is incorrect because coping skills reduce the risk. After someone stops using a particular substance, the body is no longer used to the previous dose. If they return to the exact same dose they used before, the body may not tolerate it, greatly increasing their risk of overdose. So the correct answer is B, reduced tolerance. Which symptom most strongly suggests alcohol withdrawal rather than anxiety disorder? Racing thoughts, tremor relieved by alcohol, excessive worry, or muscle tension? The correct answer is B. B is correct because relief of tremors with alcohol points to withdrawal. A is incorrect because racing thoughts occur in anxiety disorders. C is incorrect because worry alone does not indicate withdrawal. And D is incorrect because muscle tension is nonspecific. Many symptoms overlap between anxiety and withdrawal. The key difference is relief after drinking. If symptoms improve when alcohol is reintroduced, that strongly suggests withdrawal symptoms. A client uses cocaine and reports feeling emotionally flat and depressed days later. What term describes this experience? Dysphoria, craving, intoxication, or delirium? The correct answer is A. A is correct because dysphoria involves low mood and inability to feel pleasure. B is incorrect because a craving is a state or something that happens when they want the substance, not a mood. C is incorrect because intoxication occurs during active use. And D is incorrect because delirium involves confusion and altered consciousness. Which pattern best distinguishes substance-induced mood symptoms from a primary mood disorder? Symptoms improve when substance use stops. Symptoms are severe. Symptoms include sadness, or symptoms involve sleep disruption. The correct answer is A. Symptoms improve when substance use stops. A is correct because substance-induced symptoms often stop when they stop using. B is incorrect because severity alone does not equal the cause. C is incorrect because sadness occurs in many conditions. And D is incorrect because sleep problems are nonspecific. Which combination presents the highest overdose risk? Cannabis and nicotine, alcohol and benzodiazepines, cocaine and caffeine, or hallucinogens and antidepressants? The correct answer is B. B is correct because combining alcohol and benzodiazepines greatly increases respiratory depression. It slows down the breathing. A is incorrect because overdose risk is low with cannabis and nicotine. C is incorrect because stimulation is increased, but respiratory depression is likely with cocaine and caffeine. And D is incorrect because this is not a common overdose combination, hallucinogens and antidepressants. Which statement best reflects compulsive substance use? Using occasionally at social events, continuing use despite negative consequences, using larger amounts on weekends, or experimenting during adolescence? The correct answer is B. B is correct because compulsive behaviors continue despite the negative effect or harm. A is incorrect because occasional social use is not compulsive. C is incorrect because frequency alone does not define compulsive. And D is incorrect because experimenting is not compulsive. So the correct answer again is continuing to use despite negative consequences. Which withdrawal syndrome carries the highest seizure risk? Cannabis, alcohol, cocaine, or nicotine? The correct answer is B. B is correct because alcohol withdrawal can be life-threatening. A is incorrect because cannabis withdrawal does not typically cause seizures. C is incorrect because stimulant withdrawal is uncomfortable but not seizure-based. And D is incorrect because nicotine withdrawal is uncomfortable but not dangerous. Alcohol withdrawal is one of the few withdrawal syndromes that can be fatal. Seizures are a major risk, which is why medical supervision is often required. Which client statement best reflects ambivalence? I do not have a problem. I want to quit, but I am scared to. I am ready for treatment today. Or I do not care what happens. The correct answer is B. B is correct because it shows mixed feelings. A is incorrect because it shows resistance, not ambivalence. C is incorrect because it shows readiness. And D is incorrect because it shows disengagement. Ambivalence means having mixed feelings about something, wanting to do one thing, but also feeling like you want to do something else, which is quite common in substance use counseling. Which factor most strongly predicts relapse risk in early recovery? Length of substance use history, exposure to triggers without coping plans, age at first use, or type of substance used? The correct answer is B. B is correct because unmanaged triggers increase relapse risk. A is incorrect because history alone does not predict relapse. C is incorrect because age alone does not predict relapse. And D is incorrect because relapse occurs across substances. Relapse often happens when people encounter triggers they are not prepared for. The presence or absence of coping strategies matters more than substance type or history length. Which alcohol-related effect best explains memory gaps during intoxication? Reduced REM sleep, disruption of memory consolidation, dehydration, or vitamin deficiency? The correct answer is B. B is correct because alcohol interferes with memory encoding. A is incorrect because REM affects sleep, not memory. C is incorrect because dehydration does not explain memory loss. And D is incorrect because vitamin deficiency affects long-term cognition. Alcohol disrupts the brain's ability to form new memories. During blackouts, the person may be awake and functioning, but unable to store memories of what happens. Which presentation most suggests stimulant intoxication? Slowed speech and sedation, increased confidence and reduced sleep, nausea and vomiting, or pinpoint pupils? The correct answer is B. B is correct because stimulants increase energy and confidence. Stimulants speed the nervous system up, causing the increased confidence, talkativeness, and reduced need for sleep. These are classic stimulant intoxication signs. Which statement best describes harm reduction? Abstinence is the only success. Reducing risk while supporting client autonomy. Ignoring substance use, or encouraging continued use? The correct answer is B. B is correct because it focuses on safety and autonomy. B is reducing risk while supporting client autonomy. A is incorrect because harm reduction allows multiple goals. C is incorrect because harm reduction is active, not passive. And D is incorrect because it does not promote use. Harm reduction meets clients where they are. It focuses on reducing harm and increasing safety while respecting their autonomy, not forcing them to stop. Which symptom is most associated with opioid withdrawal rather than intoxication? Constipation, dilated pupils, slowed breathing, or sedation? The correct answer is B. B is correct because withdrawal causes dilation. A, C, and D all occur in intoxication, not withdrawal. Opioid withdrawal looks like the body speeding up. Dilated pupils are a key physical sign. Which factor most contributes to alcohol tolerance development? Liver enzyme adaptation, genetic destiny, personality traits, or mood disorders? The correct answer is A. A is correct because metabolic and neuroadaptation drive tolerance. B is incorrect because genetics influence risk but not tolerance alone. C is incorrect because personality does not cause tolerance. And D is incorrect because mood disorders do not cause tolerance. Tolerance develops because the body adapts. Liver enzymes and brain receptors adjust, requiring more alcohol to achieve the same effect. Which concept explains why stress can trigger craving long after detox? Acute withdrawal, conditioning, intoxication, or detox failure? The correct answer is B. B is correct because learned associations drive craving. A is incorrect because withdrawal is time limited. C is incorrect because intoxication is active use. And D is incorrect because detox completion does not prevent craving. Stress becomes linked to substance use through conditioning. Even after detox, stress can activate those learned pathways and trigger craving. Which client goal best reflects early recovery focus? Never feeling cravings again, learning to manage triggers safely, fixing all relationships immediately, or complete emotional stability? The correct answer is B. B is correct because trigger management is realistic and protective. Early recovery is about safety and skills, not perfection. Learning how to manage triggers is a realistic and protective early goal. A is incorrect because cravings are normal. C is incorrect because repair takes time. And D is incorrect because emotional stability develops gradually. Which sign most strongly suggests sedative intoxication? Elevated heart rate, poor coordination, increased appetite, or dilated pupils? The correct answer is B, poor coordination. Sedatives slow the nervous system, causing poor coordination and slurred speech. These are classic signs of intoxication. Which statement best reflects relapse prevention planning? Avoid all risks forever. Identify high-risk situations and coping responses. Rely on motivation only. Or eliminate stress entirely. The correct answer is B. Identify high-risk situations and coping responses. Relapse prevention is about planning, identifying risky situations, and deciding ahead of time how to respond. A is incorrect because avoidance is unrealistic. C is incorrect because motivation fluctuates. It comes, it goes. And D is incorrect because stress is unavoidable. Which substance is most associated with intense psychological craving despite minimum physical withdrawal? Alcohol, nicotine, cocaine, or benzodiazepine? The correct answer is C, cocaine. A is incorrect because alcohol has significant physical withdrawal. B is incorrect because nicotine has physical withdrawals as well. D is incorrect because benzodiazepines have strong physical withdrawals. Cocaine withdrawal is often more psychological than physical. Cravings can be intense even when physical symptoms are limited. Which factor best explains why some clients relapse despite strong motivation? Lack of intelligence, neurobiological changes from substance use, poor moral character, or weak values? The correct answer is B, neurobiological changes from substance use. B is correct because brain changes affect impulse control and reward. A is incorrect and it's stigmatizing. It's not true that you're not smart if you keep relapsing. C is incorrect because relapse is not a moral failure. And D is incorrect because values alone do not override neurobiology. Substance use changes the brain. Even motivated people may struggle because reward and stress systems have been altered. This is why recovery requires skills and support, not just desire. Which indicator best suggests alcohol use disorder rather than risky use? Occasional hangovers, loss of control over intake, drinking at celebrations, or drinking after work? The correct answer is B, loss of control over intake. A is incorrect because hangovers alone do not define a disorder. C is incorrect because context alone does not define a disorder. And D is incorrect because frequency alone does not define what a disorder is. Loss of control is one of the strongest indicators of an alcohol use disorder. It goes beyond when or where someone drinks. Which is a common early recovery challenge related to dopamine regulation? Increased pleasure sensitivity, reduced ability to feel reward, improved motivation, or heightened focus? The correct answer is reduced ability to feel reward. B is correct because dopamine systems take time to recover. A is incorrect because pleasure sensitivity is reduced. C is incorrect because motivation is often low early on in recovery. And D is incorrect because focus is often impaired. In early recovery, the brain's reward system is still healing. Many people feel flat and unmotivated because dopamine signaling has went down. Which statement best explains why mixing substances increases risk? Substances cancel each other out. Effects can stack unpredictably. The body adapts quickly, or tolerance increases immediately. The correct answer is B. Effects can stack unpredictably. B is correct because combined effects can amplify risk and danger. A is incorrect because effects do not cancel each other out. C is incorrect because adaptation does not happen immediately. And D is incorrect because tolerance does not protect from interaction risk. Which presentation most suggests alcohol-related neuroadaptation rather than acute intoxication? Slurred speech after drinking, anxiety when not drinking, vomiting after binge use, or poor balance during use? The correct answer is B, anxiety when not drinking. B is correct because anxiety when not drinking suggests you've adapted to that amount of drinking. A is incorrect because this reflects intoxication, slurred speech after drinking. C is incorrect because this reflects acute effects, vomiting after binge use. And D is incorrect because poor balance reflects intoxication as well. Which factor most supports sustained recovery? Avoiding all discomfort, developing coping skills and supports, high intelligence, or fear of consequences alone? The correct answer is B, developing coping skills and supports. B is correct because skills and supports protect recovery. A is incorrect because discomfort is unavoidable. C is incorrect because intelligence alone does not prevent relapse. And D is incorrect because fear fades over time. Sustained recovery is built on skills and support systems. Which counselor focus best supports exam appropriate clinical reasoning? Diagnosing quickly, linking substance effects to behavior and safety, moral evaluation of choices, or personal opinion? The correct answer is B, linking substance effects to behavior and safety. A is incorrect because diagnosis requires assessment. C is incorrect because moral judgment is not clinical. And D is incorrect because exams test evidence-based reasoning. On addiction exams, the best answers focuses on how substances affect the brain, behavior, and safety. Linking use patterns to risk and functioning will guide you to the correct answer every time. Now that you have successfully completed 50 practice drug and alcohol questions, make sure you are subscribed to my channel so you never miss another practice exam or study presentation.